because of the so-called rhythm system and things like that. There are very real human issues here. And I always try, and I think the vast majority of priests try to be compassionate, understanding, and perhaps at times backing off from what we ought to really say. Have you ever seen that? Felt that the church, or the voice of the church, is kind of weak in some of this area? Have you had that experience?
Well, I think it may be, one, in part because perhaps many priests and religious don't know there's a very effective alternative in NAPA technology. One segment of NAPA technology is called the fertility care system, and that's the system where women learn to chart their monthly cycles. To put it simplistically, they learn when they are ovulating, basically, based on certain aspects of their cycle. I'm not going to go into it in detail, but this method in a large, it was about a 5-state study with, I think, over 1,000 couples. Anyhow, they found that it was, if used correctly, about 99.5% effective at avoiding pregnancy at a year. And that is actually higher than the birth control pill. And the average use, so the average person, maybe they didn't understand exactly right on some point, 96.8% effective. The average effectiveness of the birth control pill is 92% at avoiding pregnancy. So here we have yet another example of how Catholic-inspired ethics and medicine can lead to a superior alternative when viewed against conventional OBGYN. And so many priests, religious, men and women aren't aware they have this alternative, which is clearly superior. They don't have to take steroid hormones that have many different effects on their bodies, risks of various kinds of cancer. That's simply not necessary.
And the system, actually, I have taught it to lay people who are not Catholic, and particularly through my year's training. I would talk about natural family planning just as a natural alternative to hormonal contraceptives for spacing children. And many of my colleagues were interested in learning the method for their own use, simply because it was natural and it was effective. In fact, when I was in medical school, the president of the Medical Students for Choice group switched to natural family planning because she was into the all natural, didn't want to use hormones. When I've done talks at pre-Cana, the same thing. After the talks, women come up to me and say they've been waiting for an alternative because they don't like putting the hormones in their body.
Now, you have your own clinic here in New York named after St. Gianna Lola, which is, that's kind of a very beautiful thing. This is fairly rare throughout the country that you would find an explicitly committed Catholic service. How do people get to it? How do they call up?
Well, we do have a website, which when I was watching because of the traffic, I saw you beautifully listed for us, so thank you. We can be found online. I can give you our phone number. We are right in Midtown Manhattan.
What's our email? I mean,
what's the website?
Yeah, what's the website?
It's www.gianna, Gianna health.org.
Which I spoke of it. Make sure that 2 N's there.
2 N's.
You won't go
after
through.
St. Gianna.
And it's rather fascinating that her son will be on our program in 2 weeks.
Yeah, he is coming into town actually on May 16th and 17th. It's wonderful. He's going to appear on your program. And then our center is co-sponsoring an event with the Family Life Office of New York, a special mass actually being said for the intentions of couples who are struggling with infertility.
Tell us about
or
this.
recurrent miscarriage. Just a way to show any couple struggling with infertility, but even more so Catholic couples, that the church stands with them and beside them in their struggle, and that there are alternatives available.
Where is the Mass going to be?
That'll be at St. Catherine of Siena in Manhattan on 68th Street. Mass is at 6:30.
6:30
Followed on May 17th.
May 17th at St. Catherine of Siena Church. Now that's the Dominican Church, which is right near New York Hospital. It's just down the street from New York Hospital. A beautiful church, by the way. And so that will be there at 6:30 on
May 17th,
which is what day of the week?
A Monday.
A Monday.
And St. Gianna's son, Pier Luigi, will be giving a talk afterwards about St. Gianna with a special blessing with her relics.
Isn't that marvelous? Please, if you're a New Yorker, try to get out. And if you live around the country, fly in.
Wonderful.
Now, you know, we fight on. And Christians can get discouraged. And other people, Jewish people, can get discouraged because we have the divine law. And in our histories, both the Jews and the Christians, often, as we see in the scriptures, they fall away, both in the Old Testament and in the New Testament. And people don't get things done. They fail. So if you see in the Old Testament, some of the prophets at first didn't do well, and the apostles didn't do well. But you come back and you go at it again, and you stay at it to the end of the road. Now, particularly, this is not an area that I have any expertise in at all. For 35 years, I've been a psychologist for priests and ministers about spiritual direction and therapy. So it's far away from anything I understand. But I wanted to hear you very much on this issue because priests and deacons need to be preaching the teaching of the church. When I was younger, I recall that it was preached. But unfortunately, the teaching on Sunday has become rather, well, I would say, remind me of a meeting of the Kiwanis Club. You know, be nice, be nice, be nice. They said it once, they said it twice. And we need to teaching the divine will. When people do not do the divine will, they bring catastrophe upon themselves. And we see this, a very frightening and serious example presently in the church now, that many religious communities have failed in large letters to follow their belief, their intention, their vocation. And these communities are disappearing. The average membership is in the late 70s. And nobody is admitting that we made a big mistake. So I've been very involved in trying to be with our friars and our sisters to be authentic religious. And we're sympathetic to this understanding. Some of our sisters are nurses and understand these things better.